my name is Hannah. I'm a UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead, and I provide one-to-one OSCE support and preparation for international nurses and return to practice nurses, and academic BSc and MSc support for UK student nurses as well. In my channel here, if you're new, I share a lot of my advice, teaching and support for nurses who are self-studying for the NMC OSCE exam. It's designed specifically for nurses who are studying to help you achieve that exam pass. Well done to all of those that share your success. It's absolutely great. I try and answer as many comments as I can within the time that I have available as well. In this video, I'm going to do the Alzheimer's evaluation station. So the evaluation station is the last station of your APIE, and it's basically an SBAR, structured communication handover to another professional, which could be a nurse, could be a specialist nurse, could also be a doctor or another healthcare professional as well. Sometimes nurses struggle a bit with the evaluation station, but in really you just need to think about it as handing over your other 3 APIE stations first. You need to hand over everything you've done and gathered from your assessment station, your care planning, your implementation, any other interventions that you have done or referred your patient onto, and then think about that recommendations, that ongoing nursing care or ongoing medical input. So whoever you're handing over to, what do you want that person to do? So in that preparation time, I will normally have a look at my briefing, figure out who I am handing over to, what time period has passed since I last saw the patient. So is it, a day, so many hours, is it so many weeks? Have a look at the new vital signs, see if there's anything very alarming in there, which I'd need to hand over more as a deteriorating patient. And then I just go back and review my other APIE stations and just remind myself of my assessment information, my observations for my assessment station, my care planning, and the medications that I have given. So part of that planning then, so we're going to look at our evaluation briefing. So Mr. Denshaw has Alzheimer's, and I've been visiting him for 2 weeks. Okay, so this is 2 weeks past from my first assessment station. So we're 2 weeks further down the line, been visiting this patient most probably weekly. Okay, observations here. So heart rate and blood pressure is a little bit low. And everything else is okay. We've still got 6 CIT, and I'm handing over to the Alzheimer's specialist nurse. Okay, so I'm thinking about in my recommendations, what specialist support do I want from that Alzheimer's specialist nurse for this patient? I just go up and quickly review my assessment information, just remind myself of the patient's background, medical history, social history, drug history, and allergies. I'm going to use all that to hand over. My observations for my patient. Okay, key things for my holistic, just refresh myself on that. My 6 CIT. Obviously, you'll have your care plans that you would have written, so just review over your care plans. And then my medication chart, just remind myself of what I've given here. So citalopram, paracetamol, and levothyroxine. Okay, so once you've briefed and you've got your plan, you want to start your handover. So I normally just start kind of at the top with the assessment information, because that's the first bit of paperwork I'm going to need. So I'll start with my situation. So hello, my name is Hannah Ames, and I am the community nurse working as part of from Mint Tree GP surgery. I'm handing over my patient to you, Andy Denshaw, date of birth 5th of 6th, 1943, hospital number 1234567, and address 21 Higher Road, Plymouth, and he is also located and currently in that address at his home. I'm handing over to you as the Alzheimer's specialist nurse because I'm concerned about his increasing memory loss due to his Alzheimer's and his safety in the home. He's had some episodes of forgetting how to get home, and his wife reports an increase in aggression and just generally feeling isolated and struggling a little bit to cope. So background then, so Andy's been diagnosed with Alzheimer's for 3 years. His wife rang the GP surgery 3 weeks ago. I've been visiting him for 2 weeks, concerned about his increasing forgetfulness over the last 3 months. And like I said, he's not been able to leave the house by himself as he forgets how to get home. There's also a history of reduced appetite, some recent weight loss, and some falls history, of which they've needed to call the ambulance out to get him off the floor. Medical history is Alzheimer's disease diagnosed in 2021, hypothyroidism 2018, depression 2021, and chronic headaches 2019. Social history is he lives with his wife in a 3-bedroom house. He does have to go upstairs to the bathroom and to sleep. His wife has been doing more around the home. Andy is a retired naval officer and he enjoys woodworking in his garage and uses that to manage his low mood. He doesn't smoke or drink. They do both report finding it difficult now because they're used to being quite social and they're spending more time in the house and feeling isolated. Drug history is donezepam 20 milligrams once a day, levothyroxine 50 micrograms once a day, citalopram 20 milligrams once a day, and paracetamol 1 gram QDS. Sorry, donezepam 20 milligrams once a day. I think I said micrograms, apologies. Allergies is fish, which makes nauseous and sickness. On my first assessment, and which was 2 weeks ago, and I've been visiting Andy weekly, his respiratory rate was 17, his saturations were 98, heart rate was 60, blood pressure was 110/60. He was alert but confused with his normal level of confusion, and his 6 CIT score was 17. His blood glucose was 6, temperature was 37, and the NEWS2 score was 1, just scoring 1 for the blood pressure there. It's a little bit lower than normal for him. His most recent observations are, I'm just going to go back to my evaluation. So respiratory rate is 14, so down from my initial assessment 17, but still within normal limits. SATs are 98%, which is same and normal. Heart rate is a little bit low at 55, down from 60, and blood pressure remains a little bit low at 100/60, just down from my initial assessment of 110. He's still alert with a 6 CIT score still of 17. Blood sugar is 4.8 millimoles, which is down, but within normal limits, and temperature is the same at 37 degrees. On my holistic assessment, I identified obviously increase in memory loss and finding it difficult for Andy to complete some of the tasks at home. Also a history of weight loss and not preparing meals and eating meals. And there was a lot of food in the fridge that hadn't been eaten. His wife also reports some difficulties with mobility and having some recent falls as well. So his main nursing needs has been to support his impaired memory loss, of which I am referring to use the Alzheimer's specialist nurse, but I've also implemented some memory aids and memory guides in the home. I've had a good conversation with Andy and his wife to identify areas that he does want to remain independent with. I've referred to occupational therapy for a home assessment for some aids. I've also referred to physiotherapy referral for some mobility aids due to the risk of falls. His other main nursing need has been recent weight loss and reduced appetite. So I've asked his wife and Andy to try and keep a food diary. We've also implemented some calendars and some clock alarms to help Andy remember when to eat food. I've discussed a referral, potential referral to the dietitian after completion of a must assessment, and just discussed with Andy as well about food preferences and promoting kind of just small high calorie meals if he's unable or forgets to eat a large meal. Other interventions have included giving his medications as prescribed. So at 8 o'clock, he's had his citalopram of 20 milligrams, paracetamol for his chronic headaches, and 1 gram at 8 o'clock, and his levothyroxine 50 micrograms at 8 o'clock. He's on his regular donezepam, but that's not due until the evening time. So my main areas of concern for Andy is increasing memory loss and safety within the home, maintaining independence, supporting his wife and Andy as they are finding it increasingly difficult to manage the Alzheimer's, and just providing kind of reassurance and support and following up some of those referrals that I've made. So I'd really like if you, as the Alzheimer's specialist nurse, could go and visit Andy and review their current kind of situation, offer your specialist advice and support in terms of their day-to-day living with the Alzheimer's, and provide support with their isolation as well, and to give them some guidance for some maybe some community groups or community numbers. I have, like I said, made a number of referrals, so if you're able to follow those up for me, so especially the occupational therapy for some supportive aids in the home, and the physiotherapy. Would you also be able to review Andy's food diary when you do go in, because I was concerned about the weight loss, and again review if there's been any further falls. I've also referred back to the Alzheimer's consultant as well, based on that 6 CIT. So if you're able to liaise and communicate with the rest of the team, that would be great. Okay, so that was just a bit of a guidance for you. Obviously, depends on your scenario on the day, the information that you've gathered, but just see there how I use my different paperwork from my APIE station to help me get through the majority of that SBAR information, and then thinking about your specialist advice for what you want the person you're handing over to do. Obviously, depends on your time on the day, how much information you're able to hand over, but make sure you don't spend too much time silently planning, that you don't leave enough time to hand over all the required information.